So epilepsy is more common than you think. It affects about 3 million Americans. There's about 315,000 students in the United States that is affected by epilepsy. And there's more than 45,000 new cases that's diagnosed annually with school children. 1 in 100 will develop epilepsy, and 1 in 10 people will have a seizure at some point during their lifetime. Epilepsy is more common than cerebral palsy, Parkinson's disease, and multiple sclerosis all combined. So it's a pretty common thing. So things that I'm sure you didn't know, that most seizures are not a medical emergency. You can have a seizure and it not necessarily be a true medical emergency. A lot of kids that have epilepsy, the parents know how to deal with it. They have them at home all the time. They stay on their medication, and a lot of times they don't even take them to the hospital. They just contact their primary care doctor or their seizure physician and go from there. So students may not be aware that they're having a seizure, and they may not even remember what happened after the fact. Epilepsy is not contagious. It is not a form of a mental illness. And contrary to what a lot of people think, students almost never die, and a lot of them never have any brain damage from having a seizure. A student cannot swallow his or her tongue during the seizure. I know you guys have probably heard that all your life, that somebody can swallow your tongue. That is medically impossible unless you bite it off and swallow it. Okay? It cannot happen. It can fall back and occlude your airway and obstruct your airway, but you cannot swallow your tongue. So common causes of seizures. For about 70% of people with epilepsy, the cause is unknown. They really don't, it's a lot of times it's undiagnosed as to why they're having the seizures. The other 30% is usually from some type of brain trauma from an accident they had years ago or like recently. Stuff like brain lesions, tumors that are newly diagnosed. Lead poisoning can cause seizures. Infections of the brain such as meningitis, encephalitis, measles. If they have some type of brain injury at birth, they can develop epilepsy. That don't mean they have it right away. They can develop it years down the road. And then abnormal brain development can cause epilepsy and seizures. So different types. There's 2 types, generalized seizures and then partial seizures, and then those break down into other types we'll look at real quick. A generalized seizure basically involves the entire brain. So those nerves are just firing in the entire brain, and the common types include an absent type seizure and what they call a tonic-clonic, and we'll talk about those in a second. Symptoms of a generalized seizure usually include convulsions. They'll stare out into space and have muscle spasms, and a lot of times they'll fall to the ground and start convulsing all over the floor. A partial seizure usually only involves one part of the brain, and when they're having a partial seizure, whatever part of the brain that's affected, that's seizing, is what part of the body that's going to be convulsing or jerking around or whatever. An absent seizure, these are very hard to diagnose according to the neurologist at earlier because as you see, it's a cause and activity to a blank stare. They have a brief lapse of awareness. Possible chewing or blinking motion usually lasts 1 to 10 seconds, so that's pretty quick. Can occur many times a day, and they say the reason they're so hard to diagnose is because they're confused with kids daydreaming, their lack of attention, and attention deficit disorders. So a generalized tonic-clonic seizure that we talked about, you might see a sudden hoarse cry, loss of consciousness. They could fall to the ground. Of course, they'll have convulsions where they got stiffening of their arms and legs followed by a rhythmic jerking. And if you guys have ever seen a seizure, they're like their muscles are all tensed up and you can't force their arms and bend them or anything. They'll have shallow breathing, and sometimes they may even stop breathing, but as soon as the seizure stops, they will start breathing back on their own, and they should. It's very rare that they would not start breathing back on their own. They may have drooling, possible loss of bowel or bladder control. Probably 90% of the time when somebody has a true seizure, they're going to lose their bowel or bladder control. Occasional skin, their nails, lips can turn blue, and that's from the lack of oxygen because their breathing is going to get real shallow. They can last 1 to 3 minutes, and they can be longer than that, but generally it's about 1 to 3 minutes. It may seem like eternity and seem like a lot longer than that. Usually followed by confusion, headaches, tiredness, soreness, because their muscles are just worn out after a seizure. So when they start coming around, they're going to be really confused, not really know what's going on. They may have a headache, have slurred speech and all that stuff, and that'll eventually wear off and they'll get back to normal. So the first aid for these folks having these type seizures is try to remain calm and track the time of that seizure. You want to keep up with how long that person's having the seizure. Notify the nurse, and you can call for EMS if needed. Okay, she said, Michelle said that is the protocol here, is that EMS gets called on all seizures. Check for epilepsy or seizure disorder, ID bracelets, necklaces, and I think she also said you guys pretty much know when the kids come in who has seizure disorders and so forth. Protect the student from possible hazards. So if they have a seizure, here on the floor, you want to move everything out of their way and try to keep them from hurting themselves. Move the chairs, tables, sharp objects, all that good stuff. And put the student on their side. You want to do that because if they vomit or they're drilling excessively, if that stuff runs back in the back of their throat, gets in their lungs, or if they vomit and they take a big deep breath, suck that stuff into their lungs, it's just bought them an ICU visit for aspiration pneumonia. Okay, and that's a very serious thing. So roll them over on their side, that way if they vomit, it'll come out. Cushion their head, because when they're jerking around, their head's jerking around as well. And they can hit their head pretty hard. So you want to put something underneath their head to keep them from hurting their head. After the seizure, you want to stay with the student until they're aware of their surroundings and they get a full regain of their consciousness back. Because like I said, they're going to be very confused and not really know what's going on. Provide emotional support. It's probably best to clear out everybody else away from them, because if they do lose their bowel bladder control, that's going to be a pretty embarrassing thing for them. So, and then document whatever you need to do as far as your documentation goes. And some things to always remember with folks having seizures is don't ever put anything in their mouth while they're having a seizure, okay? Especially your fingers. And I don't know if you guys have the bite sticks to use, but don't put your fingers in there to try to keep them from biting their tongue, because they're going to bite your finger, okay? If you've got like a soft towel, something like that, you can put that in there, but don't put anything else that they could swallow. Don't try to hold them down and restrain them, because you're not going to be able to. They're going to be stronger than an ox, and you are not going to be able to hold these folks down. And don't attempt to give them any oral medications, food, or drink during the seizure, because they're not going to be able to swallow it. They don't even know what's going on. Their brain is in another world, and you can cause a lot of damage by trying to do stuff like that. So when is a seizure an emergency that you need to be familiar with is somebody that's had a first-time seizure. If that's the first time they've ever had a seizure in their life, that's an emergency, because we don't know what's causing that seizure. If they have a convulsive seizure that lasts more than 5 minutes, that's an emergency. Repeated seizures without regaining consciousness is another one. More seizures than usual, or a change in the type of seizure. If they normally have a seizure that only affects a certain part of their body, and all of a sudden their whole body starts having a seizure, then there's something going on. If the student is injured from some type of activity, and then they have a seizure, if they've got diabetes and have a seizure, or if they're pregnant and have a seizure, all of those are medical emergencies. If they have a seizure, of course, in water, if they start coming back around and their breathing doesn't improve, or if the parents request an emergency evaluation, then that could tell you that they probably never had seizures before, or something's going on. A simple partial seizure, of course, is full awareness is maintained with that student. They have rhythmic movements, just isolated twitching of the arms, face, and legs that's isolated to one part of their body, or maybe one or two. Sensory symptoms, they might have tingling, weakness, hear sounds, smells, taste, feeling of an upset stomach, visual disturbances. They can have psychic symptoms, such as deja vu, hallucinations, feeling of fear and anxiety, or a feeling they can't explain. These usually last less than a minute, and they can be confused with acting out or psychosomatic illnesses. Again, these are some that are a little harder to diagnose because they don't have a lot of the jargon, it's just isolated. Complex partial awareness is impaired. They have inability to respond. They start out usually with a blank stare. They usually have repetitive, purposeful movements. They're clumsy, disoriented, aimless, walking and picking up things. And with the lip smacking, a lot of times you'll see that with the younger kids versus the older middle school age or high school. Usually don't do all the lip smacking. It's usually the elementary school or younger. Often lasts 1 to 3 minutes, and often followed by tiredness, headache, and nausea. Every seizure usually is followed by this stuff. They can become combative if restrained. So, if you got a student having one of these type of seizures and it's only isolated to one part of their body, and you try to hold them down, they can get very combative with you because they don't really know what's going on. Their brain, again, is somewhere else. And they can be confused with, you shouldn't see the drunkenness or drug abuse here, but aggressive behavior. First aid for these is pretty much the same. Stay calm, reassure others, try to track the time, call for the nurse, EMS, look for their medical ID, don't restrain them, gently direct them away from any hazards, and don't expect the students in any type of seizure to obey commands because they're not going to be able to follow any commands. Make sure you stay with that student until they're fully aware, and if the seizure lasts 5 minutes beyond what their normal seizure is, because these are kids who have these seizures usually all the time or often. If it lasts more than 5 minutes beyond what their parents say it normally lasts, then they need to be checked out in the emergency department. Status epilepticus is a true emergency. It is a continuous state of a seizure activity or prolonged seizure that occurs in a series. So I said earlier, if you have one seizure and then right as that one's ending, another one's starting up, that's status. And that needs to be evaluated in the emergency department. They're going to probably have to have drugs to stop the seizures. And it's usually most common in the very young and very old. I picked up a kid one time from their home, and Grandma was watching this kid, but she let the kid seize for 45 minutes before she actually called for an ambulance. And we said, how many times has the kid seized? And she said, the kid has been seizing solid, nonstop for 45 minutes. Well, the kid wound up with some severe brain damage because she waited, so you can see it's very important. I don't know if you guys have any children here that are in wheelchairs that have seizures, but if you do have somebody in a wheelchair that's seizing, don't remove the wheelchair unless absolutely necessary. You want to secure the wheelchair to keep it from moving, so make sure you lock the wheels. Fasten their seatbelt if they have one in the wheelchair around the student. Just keep it loose enough that they're not going to slide out. Protect and support their head, because if they're convulsing, their head's going to be moving. Ensure their breathing is unobstructed. If they're having lots of secretions, just allow those secretions to run out. Keep their head tilted, whatever you need to do. Pad the wheelchair to prevent injuries to the limbs. So if they've got, armrest or whatever on the wheelchair, and maybe some padding's broke off that came on the wheelchair, pad anything that you think might injure the kid. And follow your same procedures for caring for the students as we talked about before, and calling EMS. If they have a seizure while they're on the school bus, the driver needs to stop the school bus as safely and as quickly as possible. Place the student on his or her side across the seat, facing away from the seat back. because again, if they throw up, they don't want to let right back in their face. If they're in an aisle, just roll them up on their side, and you'd follow the same care as we've talked about all through this little presentation. Make sure that EMS gets called. If they transport, then fine. And then once everything's said and done, then the bus can continue on to its destination. And as long as they're following, school policy. I'm assuming that a kid has a seizure on a bus, they're going to the hospital. I don't know if you guys would see this. I kind of put this in here because there is a thing called a pseudo seizure, and that is a fake seizure. You see it a lot of times with adults. I don't know about children, maybe some high school kids. In Hamilton County, where I've worked for the last 15 years or so, this is not an uncommon thing for high school kids. The symptoms, they're pretty good at this, so they can mimic the symptoms of a seizure, and they can make EMS believe they're having one, or you guys, or anybody else. And it's often seen, and I hate to say this, but usually with drug abuse patients, kids who use drugs a lot. And the reason they do this is because the number one drug to stop a seizure is what? What do you think? Value. So they want that, they want the fix. And so they can make you believe they're having a seizure and get those drugs. So how can you determine if they're possibly faking a seizure? Does anybody know that? Well, if they're having a true seizure and their arms and they're twitching and convulsing, you're not going to be able to move their arms and bend them just like real easy, because all their muscles are tensed up. If they're having one of the partial seizures, most of the time someone having a seizure is going to be unresponsive. Okay? They're not going to be able to look at you, they're not going to be able to communicate whatsoever. One way that most EMS folks do it is they take one of their arms and raise it up over their face if they're laying down and drop it. If their arm hits them in the face, then they're truly unresponsive. They're probably having a seizure. If their arm never hits their face, then they're probably faking, because they've got enough to let them know, don't hit myself in the face. Does that make sense? So some seizure triggers that a lot of times may cause a seizure is flashing lights. A lot of times kids get around strobe lights, and you guys have the automatic fire alarms that have the strobes, but believe it or not, those strobe lights can actually cause folks to have seizures. We went on a flight in McMinnville several years ago with a helicopter, and just from the sunlight shining through the rotor disc turning, it created like a strobe light sensation, and there was a firefighter that had seizures, and that strobe light effect put him into a seizure while we're trying to load a patient under the helicopter. So, and hyperventilation can cause seizures. So factors that can increase the likelihood of a seizure, missed or late medications is the number one reason, because if kids have seizures and they've been diagnosed with epilepsy, they're typically on medications for that. And the number one reason that they're on medication is to keep those seizures under control. And most people are non-compliant when it comes to taking their medications. So if they miss several days of those medications, then they can start having the seizures again. And a lot of times it's not necessarily the student's fault. A lot of times it's because the family just can't afford the medications for the kids to take. Stress and anxiety, lack of sleep, fatigue, hormonal changes, different types of illness. They can have febrile seizures, which is typically seen in your younger kids. Alcohol and drug abuse, different types of drug interactions. If they're taking different medications for whatever reason, they can have a reaction to the medication that can cause a seizure. Overheating, overexertion, poor diet, missed meals. How many diabetic patients are there in the school system? Quite a few?
About 10.
Well, if you have someone that has diabetes and their blood sugar drops really low, that can also cause them to go into a seizure as well. And I said earlier that's a true medical emergency, but usually if you treat the blood sugar problem, the seizure's gone. That's just the side effect of having the diabetes. So some impact on learning and behavior with school kids is seizures can cause short-term memory loss, and when they regain consciousness, a lot of times they don't even remember what happened. A seizure, so after a seizure, their coursework may need to be retaught because they may not, again, they won't remember a lot of, and even though you can go back a couple hours, they may not remember what happened. Seizure activity without obvious physical symptoms can still affect their learning ability. The medications that they take for those seizures, if they've been diagnosed with seizures, can cause them to have drowsiness, inattention, concentration difficulties, and even behavior changes. So students with epilepsy are more likely to suffer from low self-esteem. And the school difficulties that they have may not always be related to their epilepsy. And you guys see these kids every day, so you probably know about that stuff. So tips for supporting students with epilepsy is stay calm during the seizure. I know that's hard to do a lot of times, especially if you've never seen a seizure, and be supportive. Have a copy of their action plan, whatever you guys call them here, and know what needs to be done because their parents fill those out and know what medicines they're on and all that good stuff. You should have a list of their medications and the side effects of those medicines. Encourage positive peer interaction. Avoid overprotection and encourage independence. Include the student in as many activities as possible, and then communicate with the parents about their seizure activity, their behavior, and their learning problems. Because the parents are going to know more about the kid than anyone. So in summary, again, like I said, stay calm and time the seizure, because that is very important. That's one of the first things that EMS is going to ask you is how long the kid's been seizing. And the reason they want you to time it is because, like I said, what might really just be 1 to 3 minutes might seem like 10 for you if you're not timing it. Move all the objects away from the patient and pat their head. Turn them on their side in case they vomit. And do not restrain them. Do not place anything in their mouth. And stay with the patient until they regain consciousness and become alert. And provide emotional support for the student. And like I said before, it's a good idea to get all the other students away from them, just because that could cause problems later down the road, bullying, whatever, made fun of, etc. So it's always good to get those other kids away. So just follow whatever your policy is here as far as treatment. And I think Michelle just said EMS has to be calling all of them, and then it's dealt with from that point on. And then, of course, the parents get called and they make the decision of what needs to be done. And do you have instructions with the parents on what to do if their child has recurrent seizures while they're at school? And I'm sure those are on file here as well. Anybody have any questions? I tried to make it as brief and simple as possible.